Welcome, everyone, to the 2023 PI Conference. We'll get started in just a moment. Spanish interpretation is available for this session. You can access the Spanish language line by clicking the world icon on your Zoom toolbar. Thank you for joining today's session on health insurance and patient assistance. My name is Lynn Albizo, and I'm excited, and I'm excited to welcome my co-presenter, Shannon Stamey. As IDF's Community Resource Navigator, Shannon Stamey brings a wealth of experience and knowledge to her role. Her journey began in 2011 when she was diagnosed. Okay. Do we need to redo that? When she was diagnosed with CVID, which led her to leave her career as a teacher and dedicate herself to helping others facing similar challenges. Before joining IDF, Shannon served as a patient advocate for several specialty pharmacies, gaining knowledge in navigating the complexities of insurance denials, appeals, and Medicare. Her work with patients in this capacity deepened her understanding of the difficulties patients encounter when seeking access to essential treatments and further solidified her commitment to patient advocacy. If you have IT questions as an attendee, please visit the help desk in your attendee hub. Shannon, take it away.
Okay, so our mission statement here, Immune Deficiency Foundation improves the diagnosis, treatment, and quality of life of people affected by primary immunodeficiency through fostering a community empowered by advocacy, education, and research. About primary immunodeficiency. There are more than 450 of these rare chronic disorders in which parts of the body's immune system is missing or functions improperly. These diseases are caused by hereditary or genetic defects and are not contagious. Some disorders present at birth or in early childhood, but anyone can be affected regardless of age or gender. And here at IDF, we provide accurate, timely information, resources, and support for patients and families. So what I was going to start with was choosing an insurance plan. And these are all of the different options when choosing an insurance plan. We have the employer job-sponsored plan, the marketplace, which is also called the exchange, a spouse or family members plan. If you're under 26 years old, your parents' plan, through an insurer or insurance broker, Medicare, Medicaid, which we'll get a little into here in a minute, if you're eligible. So that would be a government sponsored plan. VA benefits. So if eligible, military or Veterans Administration. So choosing an insurance plan. Within the marketplace, each state does have a website. So you will hear the word exchange used as well. To find information on this, you would go to healthcare.gov. And I did link here getting help applying via the marketplace. All of these links will be available later. Once these videos are uploaded, we will have the slides where you can click and find these resources. The next one is Medicare. So if you're over 65, or if you've been diagnosed with certain medical conditions or have been approved for disability by the Social Security Administration. And the next one would be Medicaid. So these are federal and state programs that help cover certain medical costs for people with limited income. This can include individuals, children, the elderly, people with disabilities, and pregnant women. Sometimes you will see these plans in conjunction. We do have a lot of patients that are on Medicare and may have Medicaid as a secondary. And then also military or VA plans. So I did list on here kind of the different plans, what's available based on where you live and who you are. And sometimes there are annual income limits for these programs. The next one is employer-based plan. So this is going to be a lot of our population where you will see that patients opt to go onto their employer's plan. And they will have open enrollment. And this will happen every year for current employees to select new coverage or make changes at that time. Another option is you may also buy insurance from a private insurance company or broker. Okay, so selecting a health insurance plan can be a challenging process. And basic information on this is available on this website. So we do have an insurance toolkit. Where you can go, and we do break down different options for insurance, what you should be asking your employer, what you should be asking the insurance plan. So this is very important, especially for our PI community, especially when we are looking at what options you should be looking for. So some of these questions that are very important. The first one would be asking the insurance plan for a copy of their formulary drug list. The reason that this is important is because each insurance company should have a formulary list, also called a prescription drug list. These are going to be all the covered drugs that insurance plan will pay for. That does not mean because they are on this formulary list that it will be approved right away. These usually do require prior authorizations. And within that, when you look at the formulary drug list, let's say for example, you're maybe on Kubatru or GammaGuard, you'll see that listed on the formulary drug list. And within it, it should let you know if that is going to be a medical or pharmacy benefit. So this is important because when you are prescribed a medication or a brand, you want to know if it's going to go through the medical or pharmacy side. Sometimes you will see within these formulary drug lists that it will actually list both options. And so a lot of times I do recommend patients to call their insurance company just to see, if it's going to be approved under pharmacy or medical benefits. Another question that's very important is, will I be mandated to a specific specialty pharmacy? And we'll go into this process a little bit later. But if your physician is sending you to a specialty pharmacy, usually they're going to choose someone that they're used to working with and that they know well and know that they'll be able to take your orders and start working on that authorization process. So I definitely advise patients to ask their specialty pharmacy that because a lot of times what may happen is you may be sent to a specialty pharmacy, and then you'll hear from them and they'll let you know that you're actually mandated somewhere else because of your insurance plan. And when speaking to your insurance company, they may say that you are mandated to a certain specialty pharmacy, but normally patients do have options outside of that, so it's always good to know. The next question is, are my physicians in network? I know as a PI patient, and then everyone within our community, our physicians are very important. And we want to know when we're choosing our insurance plan if they're going to be in network. If they're not going to be in network, what options, do I have as a patient? The next one is, does my plan have a copay accumulator? I know this is a very hot topic within our community right now. Basically, a copay accumulator just means that insurers do not allow copay assistance to go towards your deductible or max out-of-pocket amount. And so what that means is, let's say you get your shipment sent out to you with your medication and your supplies, and the manufacturer copay card is paying towards that. Yes, they would still be able to pay towards that, but your insurance would not count that towards your deductible and max out of pocket. And so with the copay accumulator programs that are happening here at IDF, we have worked on some legislation to get that passed and make it so that insurers can no longer do this. Lynn here is actually having a session on this tomorrow if you're interested to go more into a deep dive. That will be tomorrow. So look out for that. Some other things that you may see as well when looking into insurance is, if your drug and brand is not listed on the formulary list or prescription list, knowing kind of what your options are. So a lot of times, if you look at this formulary or prescription list before choosing your insurance, it may not list your brand, but it may list other brands, IVIG or sub-Q. A lot of times insurance companies will mandate something called step therapy, where you actually will have to start with a different brand before you can be approved for the brand that you are on. There are some ways around this sometimes, where your physician may be able to write a letter of medical necessity explaining to insurance why you need to be on either the brand you're on right now or the brand they would like you to be on. Okay, so the next part is going to be choosing an insurance plan, navigating Medicare. So Medicare is very important and sometimes can be very confusing. So how your IG therapy is billed is strictly based on your diagnosis code. And so your diagnosis code is determined by your physician, and your physician determines which diagnosis code you are going to have within your chart based on your clinical history and labs. So every insurance company is going to want to see specific labs. Some of you may have heard of the pneumovax challenge or pneumonia vaccine challenge, and also specific clinical notes such as repeat infections or anything that may be going on with you clinically. And so there is a certain list of qualifying diagnosis codes that will go under your Medicare Part B. And so if you have one of these diagnosis codes, that means that Medicare B will be paying for your infusions along with your Medigap or supplemental plan. So Medicare will pay 80%, and your supplemental or secondary plan will be paying the 20%. And again, like I said, that is all based on your diagnosis code, which we'll go through in a minute. If you do not have one of these qualifying diagnosis codes, this just means that your infusions will actually be covered under Medicare D or your pharmacy side of Medicare. So on here, and you will find this also on our website, and anytime that I do get questions here at Ask Idea, my first thing I'm going to ask you, if you do have Medicare, is what is your diagnosis code? So like you've heard throughout our conference, it's very important to know what your diagnosis code is as far as when it comes to insurance. The reason for this, especially with Medicare, like we said, is this will determine how your infusions are paid for. So we do have this list of all of the different diagnosis codes here. Some of you may recognize yours on here. So we have all those listed, like I said, on our webpage. Okay, so next thing we're going to talk about, now that we've kind of talked a little bit about commercial insurance and Medicare diagnosis codes, is actually navigating Medicare. So a lot of you may have heard of the IVIG Demonstration Act or Demonstration Program. A lot of times this comes up because patients want to know, how is Medicare paying for nursing and supplies? So if you have one of those qualifying Part B diagnosis codes, you do need to actually be enrolled in something called the IVIG Demonstration Program. The reason for this is because if you're a Medicare B patient and you're getting home IVIG infusions, so not sub-Q, just IVIG, where you do need a nurse to be coming into your home, you do need to be enrolled in this free program, which we will go through a little bit later. And that program will actually pay for the nursing and supplies. If you have a Part D Medicare diagnosis code, or if you are on subcutaneous home infusions, you do not need to worry about this. So Medicare D will be paying for your nursing and supplies. Or if you're Medicare B and you're doing subcutaneous infusions at home, you will be covered. So this is only for patients that have a Part B diagnosis code and are on IVIG. And I wanted to briefly go through this next part. So there are some exciting things coming up here on the horizon with Medicare. And this is all due to the Inflation Reduction Act. And this is for just Part D patients. So if you do have a Part D diagnosis code and you are going through your Medicare pharmacy benefits. And so basically what this is when patients are getting infusions and they're going through Part D, they do have high costs each month. And so even when you get to your catastrophic phase in Part D, you will be paying 5% until your benefits start over. So this is very important for Medicare D patients, and any of you out there that do not have a Part B diagnosis code, know exactly what I'm talking about, just because of the high cost that you do have per month to infuse. And so what this means is in 2024, they're actually getting rid of that 5% copay per dispense. So that will be called, the 5% coinsurance, and that's for catastrophic coverage. And so basically what that means is, in 2024, if you're a Part D patient, you will have a cap of about $3,250 per year. So right now in 2023, you usually pay about $3,100. And then you are also on the hook for that 5% copay per dispense. And anyone here that is on infusions knows how expensive they are. And so even that 5% is definitely a burden for Medicare D patients.
Shannon, sorry to interrupt.
Yes.
I just wanted to add one thing about the what you were talking about, the demonstration from when you're talking about 2024, we did a legislation passed so So starting in 2024, you won't need to have to be enrolled in the demonstration. There'll
Yes,
be codes for the nursing and supplies as well as the payment. So, but through this year, you still need to be enrolled in the demo for Part B. But for Part D, you can keep talking about what's going to happen in 2025. Thank you.
yes. And we'll go through that a little later as well with the scenarios. Yes, thank you for bringing that up. And then going to 2025. So there also is going to be a cap on Part D out-of-pocket spending. And so what this means is the cap for out-of-pocket spending in 2025 for Part D patients is going to be about $2,000 per year. We did list here how much, out-of-pocket costs on average are for Part D patients currently. And so you can kind of see here, as of 2023, it's around $7,400. And you can kind of see the different years here and how it has gone up each year that passes. And so this is a huge win for Medicare D patients. And the next thing I really want to bring up are Advantage plans. So Advantage plans are marketed to the Medicare population. And with these Advantage plans, they do advertise that you will get other benefits that you would not have on original Medicare. So this includes dental, vision, and other options that you can have within that plan. The hard part with Advantage plans for patients within the PI community our Advantage plans get to choose how they're going to cover and how they're going to pay for your immunoglobulin infusions. The reason that this is sometimes detrimental is because, let's say you have a Medicare Part B diagnosis code and you have an Advantage plan. That does not mean that your benefits will be a Part B. The Advantage plan may decide to process that through Part D, and therefore you're going to have high out-of-pocket expenses. And so I always let patients to know to definitely ask those questions, how are infusions going to be covered? Because we have a lot of patients that do call in stating that they're on an Advantage plan, but they're owing high amounts per infusion. And normally with those, I've seen a lot that have, a max out-of-pocket amount, but that amount may be like up to $6,000. And so we like patients to know that while Advantage plans do have benefits to them, such as, vision and dental, just to make sure to ask those questions when looking into an Advantage plan. The next thing I briefly wanted to touch on is low income subsidy. So this is for Part D patients, and you can look on the Medicare website. I did have that link earlier about if you're eligible and may be able to get extra help. Low income subsidy is also known. You may see that as extra help, but definitely something to look into to see if you are eligible, especially if you're going to be covered under Part D or you have other prescriptions that you're taking and that you're having to frequently access your pharmacy benefits. Okay, so the next thing I wanted to talk to you about was failure to enroll. So this is for Medicare patients again. So your initial enrollment period is generally when you turn 65. We do obviously have patients that are going on Medicare earlier due to disability. And so this section I'm talking about, the initial enrollment period, being when you're 65. So it normally lasts for 7 months and is 3 months before you turn 65, and then it ends 3 months after that. Now it's very important to make sure that you do enroll within this period of time, because otherwise you will have a penalty. So each full year of delay that you do not enroll, you get 10% tagged on to your monthly premiums. So if you are turning 65, just make sure that you are enrolling within that 7-month period, so that you do not get that penalty. And I also did link them in here as well, just for some information. Okay, and the next part, and our favorite part, is copay assistance. So the first thing I wanted to touch on was manufacturer copay assistance. So when you are prescribed a brand of immunoglobulin, I always recommend that you look into that manufacturer's webpage to look at their copay assistance. We are seeing more and more that, specialty pharmacies, with the amount of patients they do have, may not notify you of this copay assistance. I always like to say, basically, it's free money for you as a patient to access. There are no requirements for this, except for that you have a commercial insurance plan. And so what that means is you do not have a federally funded insurance plan. So unfortunately, Medicare, Medicaid, etc., you're not going to be eligible for manufacturer copay assistance. But for patients that do, like I said, A, have commercial insurance, and then B, have been prescribed that brand of immunoglobulin. So definitely look into that. Most of the brands, the enrollment process is very simple. You either can call in, or some manufacturers allow you to do this online, and some do have some enrollment forms. But I really wanted to touch on this because as a patient, it is very important to make sure that you follow this information. And what I mean by that is, once you start the process of enrolling, just making sure that you track it and get that approval information. So some of these manufacturers, you will call in to the program, and you'll be able to answer questions live time and get that approval information. Normally it's a series of numbers that I always tell patients to write down and save, because a lot of these programs no longer send out approval letters. Some of them may, but I always like to have that myself, just to track that. So writing that down, and then once you are approved, providing that to your specialty pharmacy or the infusion suite. And the reason that this is very important is because a lot of times, even if a specialty pharmacy is made aware of your approval, that does not necessarily mean that it will be billed. And so I just recommend that once you do have this information, calling your specialty pharmacy or infusion suite, making sure that that information is added to your billing profile. And the best way that I could recommend to do this is to call in and ask for a billing team member, the billing department, and make sure that you provide them that information and it is added to your profile within their system. And then it kind of goes a step further. So a lot of us know, being a patient, if you are getting those calls to set up your shipment, a lot of times it is a customer service agent or a advocate that doesn't necessarily have anything to do with the billing piece. And so I myself as a patient make sure to track this and make sure things are being billed properly. And the process for that would be, and I'm just going to use a specialty pharmacy, for example, is they would bill your insurance first, and then anything remaining, they would take and bill to that copay program. And a lot of times what I'll do is I'll just call the brand that I'm on, I'll call their copay assistance and just make sure they are seeing those claims come through. And then obviously you should be able to see, once you do receive a bill from your specialty pharmacy, if you do receive a bill, that should have been taken off your total amount. So that's just kind of responsibility as a patient, that I think is very important, because a lot of these things can fall through the cracks. And manufacturer copay assistance a lot of times does have a time limit on it. A lot of times that can be up to 3 months, but you don't want to get too far past that, and then the specialty pharmacy or infusion suite not being able to backdate that. So it's very important to know that as the first thing here. Next, I want to talk about some nonprofit organizations. So this would be for anyone that, even if you have commercial insurance and you do have a copay card, some of these copay cards may be maxed out, especially towards the end of the year. You may use up all of your funds, and then, you still have not met your max out-of-pocket amount. And we do see a lot of calls from patients that run out of that manufacturer copay assistance, or on a federal plan like Medicare or Medicaid, and they're looking for financial assistance. So we do know of a few nonprofit organizations that can provide funds to primary immunodeficient patients. The one thing I will say though is that I would look into these organizations and definitely make sure to check in frequently. With these, I know at least one of these the other day did have a wait list you can get on. But I will say that when there are openings or a wait list, a lot of times those go very quickly. And so I always want to make sure people are watching these, so that if they do open up, that you do apply, and make sure to watch for communication from that company or nonprofit organization. I know some of them say once you apply, to look for an email. So it definitely is something, again, as a patient, to track and watch, because there's only a certain amount of assistance that they can provide. So it definitely is worth it to watch. Also, I added on here the PN Foundation's Fund Finder. So I'm personally enrolled in this as well, in case I do get questions from patients, but you can get alerts if anything does open up. And so definitely worth enrolling in that as well. And then the next thing I really want to talk about is assistance from specialty pharmacies, infusion suites, or hospitals. So a lot of times with this, we will receive calls from patients that are looking for financial assistance. And I always advise to ask. Coming from the specialty pharmacy world, I know if I was at a company that did have financial assistance, we cannot tell a patient that. You don't ever want, a company doesn't ever want to look like they're trying to provide you assistance for a certain reason, to get your business or anything like that. So definitely ask, because they're not going to advertise that. And knowing that with this financial assistance, if your specialty pharmacy does provide it, or infusion suite or hospital, this is going to be income based. And so you will need to provide income documentation. I know that each of these are going to have different requirements, but definitely speaking them and seeing what those requirements are, and what you need to provide. And again, just knowing that if there is financial assistance, it obviously is limited as well. Meaning that, normally once they hit a certain amount of patients on it, they may need to wait until next year to be able to accept more patients into that financial assistance. But it's very important to know that that option is out there, and just asking. Okay, the next big thing is denials and appeals. So if you are an immune deficient patient, you know that this is a huge topic, that is very prevalent. So the first thing I want to say is, don't be discouraged. Denials are very common. You know, a lot of times we will see insurance companies that will get everything needed, and deny it basically right away. So this is common. And I want you to know, that the first thing when you do get denied is to look for that denial letter, or ask your insurance why it was denied. A lot of times we see that with these denials, they will just say to wait for that letter. They're not going to tell you over the phone. Sometimes your doctor may get that letter before you even do. But you definitely want to know the exact reason why it was denied. A lot of times we're going to see these denials, you know, medical versus pharmacy benefits. And what I mean by that is sometimes, you know, especially pharmacy infusion suite, they may try to get it approved under the wrong side of things, the wrong avenue. This has personally happened to me more times than I can count, but basically, when you go to a specialty pharmacy, I'm using that again for an example, they're going to check your medical and pharmacy benefits, or they should. And sometimes what may happen is you can go through your medical benefits with this specialty pharmacy, but if you were to go through your pharmacy benefits, you would be mandated to another pharmacy. And so a lot of times your specialty pharmacy may come back to you and say, okay, we're going to do it through your medical benefits. And you as a patient can definitely ask those questions of, you know, well, my pharmacy benefits would probably be less expensive for me. What are my options there? And a lot of times that may be your pharmacy benefits are mandated somewhere else. But I definitely like to ask those questions as well. But sometimes I've had it happen, and I know a lot of patients have, where, you know, they submit it and it's submitted to the wrong side of things. And like I said previously, on your formulary list, the insurance's formulary list, it may just be that, hey, you know, my Gamagard or my Cuvitru is through my medical benefits only. And it may be that prior authorization request that was submitted to pharmacy benefits. And what I see over and over again is that denial will come, and then it's being appealed again and again, not realizing that the reason it's being denied is because it needs to be under the medical side. And so that is actually probably one of the number one reasons I see that these insurance companies are denying and not necessarily making it clear why it's denied. And you know, I know doctors' offices and especially pharmacies, you know, and patients are going to get very frustrated by that because, hey, we're providing you everything that you're asking for, and yet it's still being denied. So that's kind of one of the first things to look at. We also do have a lot of, if let's say your doctor orders a brand for you, sends it out to the specialty pharmacy, and they submit it not knowing that that drug is not on the formulary drug list. So that's another thing. And the next thing I want to get to is your diagnosis code documentation. So what I mean by this is all of your original lab work, all of your office notes, and your diagnosis code. All of that needs to match. And we do see it a lot where that does not match. And what I mean by that is you may have CVID listed as your diagnosis code, but yet all of your doctor's office notes say a completely different diagnosis, and you don't have anything to prove that you have CVID. And so in the denial letter, it will probably be confusing in how they word it, but just basically saying, hey, like, we don't have proof of this. Why does this not match? You know, so just making sure that kind of all that your ducks are in a row, And making sure if you do catch any of that on your doctor's office notes or their summary that they provide you, just making sure everything matches up. That's very important. And even more important when you get, when you're on Medicare, become Medicare age. So those are just kind of some common reasons that we do see denials. Other times I kind of joke that, I'm not even really sure if insurance companies read it. Because you may see a prior auth request submitted and not even 5 minutes later, the denial letter is faxed. So just basically, I'm trying to say, don't give up. It's okay. It's very common to see these denials. And then kind of going into the next step, appealing. So appeals for immunoglobulin therapy, I feel like is changing frequently. And what I mean by that is it used to be, quote unquote, back in the day where a lot of times if your infusions were denied, your specialty pharmacy may appeal it. And what that means is they would help your, doctor's office in getting a letter of medical necessity or having your doctor's office set up a peer-to-peer. But a lot of times, more often than not, I'm seeing that's not really happening anymore. And so here's another opportunity for you as a patient to really advocate for yourself, fight for yourself, and definitely stand alongside your physician to help them as well. Because we all know there's not enough hours in the day and they're seeing a lot of these denials and they don't have enough manpower to appeal all them, and especially like in a timely fashion. So I always say as a patient, just number one, knowing why it's denied, and then what can I do to help to appeal this? IVF, we do have an awesome webpage here about how to appeal a denial. We do have one also that's more specific towards physicians, which is very important as well. I always like to learn all that on my side of things as a patient, like, hey, what is my doctor seeing and what are kind of their responsibilities and what do they need to do next? So if you have called in to ask IVF, normally you'll see I'll provide you both these web pages. Like I said, very similar, but one's geared more towards the patient side, the other towards the physician side. And so within this, how to appeal, you're first going to see why I was denied, and then what am I going to do about it, right? So if there's anything on your end that you're seeing, hey, it was denied because my diagnosis code, or, oh, maybe, my original lab work was not faxed in, or, they need X, Y, Z, and you as a patient may even have that, old medical notes from another doctor or anything you can provide your physician. And then also, helping provide them any information that may be helpful in a letter of medical necessity. So normally a letter of medical necessity is written by your physician. I will say we do see a lot of patients do this. I personally done it as well, where I do start drafting that letter of medical necessity myself. The reason I say that is, again, time. Honestly, no one knows you better than yourself, right? And kind of your history. And so I really take the time to look at my denial letters and figure out what's the next step. And so what I do is I'll start, drafting that, putting in there all the pertinent information that's on the denial letter so it can be faxed back in from your provider. Just kind of starting that for them and helping them. I know this does kind of sound overwhelming and, but I will say the more you start kind of looking into this, and even if you don't have any knowledge of this, it took me years to get to where I'm at. Just starting it and having, that relationship with your doctor's office. And again, normally this is going to be more often than not the medical assistant at your doctor's office, or maybe a physician assistant that really does work on these appeals. And just kind of having that communication with them and trying to help them. So I always kind of start this draft and get it over to the MA at my doctor's office, kind of let them know what's going on. Sometimes they may not even be aware it's been denied yet. I just go that avenue, and this is for me personally, but working more that side of things, and then keeping, you know, my specialty pharmacy updated. Because there are some specialty pharmacies out there still that are, you know, working on this and have the manpower and the advocates to do it. I'm not saying none of them do, but more often than not, I always just think it's helpful to know where things are at and do anything possible as a patient to help push this along. Another option is a peer-to-peer. This is a great option if your insurance company does allow it. So normally in the denial letter you receive, which they're getting longer each time. One I got recently, I think was 12 pages long, but in it does, a lot of times we'll say, here's how you can appeal this. And the options will be to fax in more info, which you want to have that letter of medical necessity in there. Sometimes we'll talk about a peer-to-peer option. And what this means is your physician can call in and be set up with a physician at the insurance company and basically plead your case. So this is a very great option if your doctor is willing to do it. And a lot of times physicians do like this because it's easier than doing all the paperwork. They can have an open conversation with that physician. And a lot of times they will get that determination the same day on the phone or quickly thereafter, where a letter of medical necessity or appeal may take a little longer.
Hold on a minute. Just a minute. Sorry, for some reason I'm not. Can you hear me?
Yes.
Okay. Did you hear me before? Sorry about that. For the next portion of the session, Shannon will be walking the audience through some commonly encountered scenarios when it comes to navigating health insurance and patient assistance. Though these examples are for demonstrative purposes during the session, we have based these scenarios on real questions that we receive from patients. Before we begin, please remember that everyone's treatment and condition is unique. The information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. Thank you.
Okay, so we decided to kind of pull some common questions that we are receiving here at IDF and kind of some scenarios. I did get a little bit passionate about the denials and appeals section, so we don't have as much time as I had originally thought. But I did want to say, if you do have any questions on, insurance and, all the topics we have discussed today, make sure to reach out to Ask IDF, and you can find out how to do this on our webpage. You can either call in or submit it on the portal and get a response that way. So I kind of talked about this earlier, but a couple of the scenarios that we do get a lot of questions about are, in the beginning when you're first diagnosed, what happens next? And then also about the reauthorization process. So when you're first diagnosed, I've kind of gone through a lot of this already. But your doctor is gonna order, whatever brand of infusions they want you on. They're gonna get all the office notes together and they're gonna either, they're gonna submit it to insurance or they're gonna have specialty pharmacy do it. And then, wait for that approval and then kind of what happens after that. So basically, like I said before, what are kind of all the questions you need to be asking before it's submitted? It's not uncommon to be denied. Once it is approved, kind of the process of starting that. So I want to say the biggest thing again with being a patient, the responsibilities that you have or should have are kind of keeping track of all this. So as far as insurance, when you're first approved, you should receive that approval letter. And if you don't, I definitely recommend asking insurance for it. On this approval letter is going to have the authorization dates. This is very important because once that is expired, as a patient, you really do not want to accept a shipment from your specialty pharmacy or go into the infusion suite after that date. So if your authorization expired, let's say the beginning of June, and you're getting automated calls from your specialty pharmacy, or you're getting, calls from the infusion suite to set up your next infusion, as a patient, you do not want to do that. Now, a lot of times, the infusion suite, specialty pharmacy may not be aware it's expired. They may have not even started the reauthorization process. And what that means is if you get that shipment or you go and do that infusion, it's not approved. There are some situations where it may be able to be backdated once it's approved, but I wouldn't count on that. So that's the one thing as a patient myself, I keep track of when does my authorization expire? And then also when do my orders expire? So those are totally different. So when your doctor writes the script, like they would for a prescription they send into your local pharmacy, that's going to have an expiration date, and that can also affect your shipments or your infusions. So if that's expired, you may set up a shipment and get a call, hey, we can't send this out, we don't have current orders. So that's something I like as well to keep track of on my own. And when I know it's coming time, I make sure to reach out to my doctor's office and get that sent in. Reauthorization process. So another thing as a guideline that I would keep track of is if you know that your authorization is about to expire, now's the time for you to be proactive. We normally say a few months before it expires. Make sure to reach out to your doctor's office, get in there for an office visit, and then a lot of times they're going to want to see new labs, so lab work, and get that to your specialty pharmacy or doctor to submit to insurance. And the reason insurance wants to see all this is they really basically want to just prove that, hey, you still have your immune deficiency, and which is an interesting point, but also want to make sure that you're seeing your doctor and you're getting that updated lab work. Question I get a lot is, why do they need to see updated lab work? Your levels are going to be high, so don't worry about that. If you're on infusions, your levels are going to be higher. I don't know the answer on why they need to see it, but a lot of times they do want to see it. Every insurance company is different. Some may accept labs up to 6 to 9 months ago. Some want to see labs within the last 6 months. It really depends. So those are just kind of some scenario type things I wanted to go through, and kind of what's important on your end that you can proactively take care of, so you don't end up in a situation where you're without your infusions. Lynn had brought up earlier about the IVIG Demonstration Act. Just quickly, I know we don't have a lot of time here, but I wanted to let you know, if you're currently enrolled in 2024, you don't need to do anything. You'll be automatically re-enrolled, as it will be a permanent benefit. If you're currently not enrolled in the demonstration program, you can go on to the Noridian webpage and enroll there. It's a form that you will fill out and your physician, and then definitely keeping in close contact with Noridian. You can call in, make sure that you stay on them basically till you're approved, and then letting your specialty pharmacy know, hey, I can now do home infusions because I'm enrolled. And I had a few other things I was going to go through, but I think we did really touch on a lot of those. Again, like I said, if you have any further questions, reach out to Ask IDEA. And I want to thank you so much for joining our session today. As you know, this session is one of 39, which is awesome. A lot of unique learning opportunities. And we love having all of you here. And one last reminder, if you have any further questions as well about copay accumulators, Lynn and our other coworker, Matt, will be doing a 2023 policy update webinar tomorrow at 4 p.m. Eastern time. If you can't join live time, it will be uploaded to the CVent platform, and then eventually to our IDF YouTube page. We hope you continue learning, and I hope everyone has a wonderful night.
Thank you.